This is a $20 test that tells me more than most $2,000 panels. Many people think that omega-3 testing is about fish oil. It is not. This omega-3 index test will tell me how inflamed your cell membranes are, how vulnerable your LDL is to oxidation, how resilient your cardiovascular system is, and how well your body can resolve inflammation and not just suppress it. Let me show you why this matters. First, the omega-3 index. Optimal is 8 to 12%. This patient here is 4.3%. That is low by both conventional and functional standards. Why should we care? Because omega-3s are literally built into your red blood cell membranes. Low levels mean stiffer membranes, poor oxygenation delivery, impaired signaling, and higher cardiovascular risk, even when cholesterol looks fine. So now let's look at the EPA and the DHA. Both are low. EPA, well, it helps to turn off that inflammation. DHA stabilizes those membranes, protects the brain, and reduces oxidative stress. What does low EPA and DHA mean? That your LDL is more likely to oxidize, endothelial function suffers, inflammation is harder to resolve, and that cardiometabolic risk rises, even if you have normal CRP. Now, look at that omega-6 to 3 ratio. We always want this under 7. This patient is at 8.7. What does that tell me? It says that their diet is tilted toward inflammatory fats, seed oils, even if calories and macros look clean. Then there's the AA to EPA ratio. Ideal, 5 to 10. This patient is at 13. That means that their body is primed to produce inflammation and less capable of shutting it down. And here's the key point that most people miss. You can have normal cholesterol, a low CRP, and good or normal labs on paper, and you can still have high inflammatory vulnerability at your cellular level. This test explains why the LDL particle number will stay stubbornly high, why oxidized LDL risk is elevated, why IGF-1 can still be suppressed, and why cardiovascular risk doesn't match standard labs. And guess what? It can cost as low as $20. This is why functional medicine looks upstream, because you don't get heart disease, neurodegeneration, or metabolic dysfunction overnight. You get membrane and mitochondrial dysfunction first. If you want to understand your real cardiometabolic risks, then this test needs to be included in your panel.